Good morning, guys. Almost most of the people understand the concept of the transplantation nowadays, and at times they know better than many young doctors about the concept, pros and cons about the transplantation. Well, usually this transplantation baldness patterns will not go just like a textbook, just like some other illustrations, because usually male pattern baldness described class 1 to class 7 types. It looks like a simple, but though when it comes to reality and practical stuff, usually most of the patients may have a combination of the male pattern baldness or diffuse pattern baldness or diffuse unpatterned baldness. So combination of this can lead to a lot of confusions whether I can go with a transplant or not. And also when it goes to the kind of getting a transplant done, you would not get transparent information because of this lot many combinations. So well, to show you basic information about these kind of cases, what are the precautions one's supposed to take, surgical point of view as well as the patient point of view, in the sense what kind of basic things patient should know or what kind of important factors doctor has to keep in his mind before planning your transplantation. Kindly watch this video until end to understand. I'm going to show you one such kind of a complicated case. For such cases, what are the steps very careful to think about before planning for the transplantation. Usually, most of the patients suffer from combinations. This patient looks like class 4A type, but it's going to be class 5 baldness. But however, he has some mid-scalp hair, which is density is there, that is not completely bald. And even other areas like front and crown area also, it's not completely bald though. So that's the reason this is a kind of a combination of the male pattern baldness with kind of a diffuse pattern, I can say. Here, important thing in such cases, what we have to think about is we need to understand the age of the patient. He's supposed to be about 25 or 26. And second important point is observe the donor. Donor is supposed to be super, otherwise this kind of patients require huge number of grafts. Well, in the beginning, we just observed his donor. His donor area is beautiful. Donor is excellent and he has got a thick hair. Once we observe the donor quality, then we can come to conclusion that we can go with a transplantation. Okay. So well, here a patient has his concerns like, I want to get my hair back in the front and back. This is a kind of a tricky case because he has baldness front side, crown area, as well as the mid scalp. So here, important plan is, see, this kind of patients definitely may need second session. So kindly keep in mind. And also, if you want to get some results during the first time itself, we're supposed to go with at least 3,500 to 4,000 grafts. Otherwise, we don't get any remarkable change there. Well, this patient again comes to the plan. We made such a way that we need to implant more grafts in the frontal area and crown. Next priority is mid scalp. Mid scalp also, if you can divide into right and left, right side we made more grafts because he's going to come from right to left. These are the plan we made it, and we have taken a little higher hairline to preserve or conserve, to save the grafts, to get the more density in the mid scalp. This is the idea we made it. This kind of meticulous plan is customized plan to each and every patient. The most important factor to consider to get the better outcome. Well, imagine we promised him 4,000 grafts because there is a limit per day. What if you're going to get only 2,500 grafts in such cases? Then surgeon has to have guts to tell you that you got only 2,500 grafts, where I'm going to change or modify my plan. I'm going to implant only in the frontal area, not in the crown. Otherwise, you neither get hair in the front nor in the back. So here, that means, having said that, required grafts are different, targeted grafts are different, harvestable grafts are different. So required grafts in this patient could be more than 6,500, targeted grafts for 4,000, harvested grafts for 3,950. At times, you may end up in 2,500 grafts. That's the important factor to choose a honest and transparent surgeon to get you best outcome. Otherwise, they may promise 4,000 for you, probably they would get only 2,500. How do you handle it? So that's the reason a meticulous plan and what kind of baldness you're suffering from. And another point is, kindly do not ignore the fact, basically, irrespective of the classification of the baldness, either class 2, class 3, class 7, what is the size of your scalp? What are the plan you're going to make it decides the grafts requirement. Imagine your scalp is very big, you need more grafts. And imagine if you're going to make hairline little lower, you need more grafts. So a plan and scalp size, available grafts, resources, all these three has to be balanced. So whatever, this patient we have done more than 3,950 grafts, and the beautiful outcome we achieved it with a customized plan. So now, kindly remember, this kind of patients also would need a second session if you lose more hair in the future. Suppose if you would have ended up in getting only 2,500 grafts, second session is a must for him. So now here, because we got around 3,950 grafts, second session could be optional. We can recommend second session couple of years later, or if you lose more hair after 6 months or 1 year, he can consider himself to go with the second session. So these are the few important factors one has to consider about this kind of baldness. So finally, it's very important to choose your surgeon who can understand your problem. See, as a patient, you may have a lot many questions in your mind, a lot many expectations in your mind, but what exactly a surgeon is going to plan to your case? What exactly he has in mind about your outcome? What is the plan he's going to implement? How does he's going to manage the balanced, available resources of the donor and scalp size? All these calculations has to be done before doing your transplantation. So I would always recommend you guys to see your surgeon, take complete information about your case than just going about internet things or Google things or just looking at your patient's transplant. You cannot go with your transplant. You need to talk to your surgeon. What is the availability of the donor? Is it good or not? What is my size of the scalp? How many grafts that I would need approximately? What are the mathematical calculation we're going to make it? Probably this is not 100% correct. Suppose you need 6,000 grafts. Kindly remember, all 6,000 grafts may not grow. So that is the reason we need to choose the best surgeon. And while doing a surgery, nothing great we would do. We just do taking from backside hair roots and implanting and the relocating in the frontal area. That means we are not going to buy any hair for you. We're going to take it from back to implanting in the front. That means you have to choose the best surgeon. That's very important step in your transplantation. That means you cannot buy your hair. It's very precious. So it makes sense to choose a best surgeon, because who's going to take meticulously without damaging your hair, and who is going to implant in the frontal area with a nice angle, nice tilt, you're going to get a natural hair transplant. Otherwise, you will end up in a disaster. So kindly visit, take information, then go with your transplantation. Thank you.